Welcome and thank you for participating in the Trusted Coaches Verification Card program. This video is designed to help youth coaches become prepared to handle and prevent common injuries in youth sports. Expect to learn the basics of first aid, what you need to have in a first aid kit, how to prevent injuries, how to deal with some common injuries, and how to handle return to play issues. This video is roughly 30 minutes long and concludes with a quiz.
Preventing injuries really start with a positive coach, a positive environment for a positive culture. What I mean by that, a coach who has a positive culture is not only towards their training, understands maybe pushing the child too far or what's enough or what's not enough, but also even the surroundings around them. How do they respond to referees? How do they respond to certain parents, other coaches, other kids? So a positive culture for athletics is critical for injury prevention.
At the beginning of the season, coaches should recognize that kids come out for sports for many reasons. Oftentimes they'll come out as a social event to be with their friends. They like to compete, but above everything they like to have fun. So coaches at the beginning of the season really need to set the tone to make sure that they're fostering a positive environment for all the kids and making things fun for them.
Especially at the youth level, because a lot of the kids are just getting out there for the first time, and if it's not fun for them, it's not going to be something they want to do for a very long time.
With getting to know your players, as a coach we'll get to know his players, how they perform on the field, which ones work better on the right side, which ones work better on the left side, which ones work better on offense and defense. Medically wise, you need to know those same characteristics of your athletes. Getting to know the inner perspective of each of your athletes injury-wise is very important. To know when you can push them, when you have to pull them back, when there might be an injury, when there might not be an injury. You know, athletes will cover up injuries sometimes because they want to play. Other athletes won't cover up injuries, they'll make them worse than they are. So getting to know the personality of each of your players is very important. Just as it's important with understanding what the best situation for them to play is, getting to understand and know your players so that you can keep them healthy is just as important.
A medical card is helpful for each kid coming into the program that might have several questions on it that may be in relationship. Is there any prior history of fractures, any heat illnesses? Are they prone to or have had concussions or fractures in the past?
A youth sport coach probably doesn't need a real in-depth, thorough medical history, but they need to know some highlights. For instance, is a kid diabetic? And even going further than the player is, what about the parents' history or brothers and sisters' history? You know, do they have a brother or sister who's torn both ACLs so that they could be more susceptible to that? Do they have a parent who's a physician who's going to be at all the games? There's just a lot of good things you can find out from just a real good basic family medical history, including his own medical history. Has he had any broken bones? Has he sprained their ankle a lot? Dislocated fingers? Do they wear contacts? A major one is, are they asthmatic? You know, if you're asthmatic, well, you need to have some medication for that on the sidelines for the players.
Every season comes with some injury, and I think one of the most important things a new coach or a system can be doing is setting up some sort of communication method with the parent. Whenever there's an injury, there's always going to be some hysteria around either the child or the teammates or the parents, and being able to have a parent meeting planned and having a medical setup as far as the contact information with parent, maybe some simple things of knowledge of the children's background. Maybe there's a history of diabetes or something else with the child that the coach really should know before going into the season. So the more information the coach can have prior to meeting the parents and children, I think it will prepare him or her to have a little bit more successful season as far as treating injuries.
Having that card with you at every game, traveling with you at home events, so if a situation were to arise, you have that at your fingertips, who to contact, maybe some insurance information, things of that nature.
A very valuable part of the medical history form is finding out what the parents do for a living. Are they physicians? Are they pharmacists? Are they physical therapists? Are they athletic trainers? Do they coach at the high school, junior high level? Because those resources can be invaluable for coaches to know. First of all, who's in the stands? You might have an emergency room doctor at every one of your games, which is invaluable to have.
So another basic bit of information, but conversely very important thing to keep in mind is your first aid kit. Always want to have that stocked during the season. Having some very basic supplies such as gloves, Band-Aids, gauze pads, ice packs, hydrogen peroxide, even some coach tape to have on hand is very important. So in addition to maintaining a well-stocked first aid kit, you also want to have some form of communication, such as a cell phone, so you can make that emergency call if necessary or contact parents as necessary. Upon arrival to your sporting venue, contact the site supervisor. Make sure you're aware of any automated external defibrillators and where they may be located, if there is one. Every site may not have an AED, but it's important to know if there is one, how fast do you have access to it and where can you access it.
With assessing fields and your facilities, it's like assessing the weather. If we look at the weather and we know it's really cold or really hot, well, we have to address that. Same thing with addressing fields and courts and stadiums. You may even look at the lighting. Is the lighting good or bad? If you're a baseball player, are the lights in a spot where if you look up for a fly ball, the light may be in your eyes? For soccer players, you need to look at the field, indoor and out, indoor turf and grass outdoors. Are there holes in the turf? Does the turf slant one way or another? Are there poles in the area that aren't padded?
It's your responsibility to keep you and your athletes safe. If they're unsafe, it needs to be addressed either to the league official or to the official that is on the field to not start the contest until some of that has been taken care of that would in any way compromise the health of the athlete.
The theory behind an active warm-up is to get the athletes warmed up. It's good to get them moving like full body movements, whether it be skipping, jumping, light jogging, hopping, just to get all their muscles moving, get the blood circulating, get their body warmed up so they're loose and limber. But you don't want to go into practice being tight, being cold. That's where the injuries are going to happen. And it causes injury to stretch a cold muscle. If you think of silly putty, maybe if you have silly putty sitting in the refrigerator and you try to stretch it, it's going to snap, it's going to break. If you have silly putty that you warmed up in your hand and you've moved it around and then you try to stretch it, it's more flexible and it's not going to break. So that's kind of the same thing with your muscles. If you stretch a cold muscle, you're going to strain it, you're going to cause injury. If you get your body warmed up and get active, get the blood circulating, you're going to be warm and it's going to be easier to stretch those muscles and to do activities without causing injury. The athlete should be starting out slow to get warmed up, maybe a light jog, running around, doing some skipping. It'd be a good idea to get the full body, arms and legs moving, so 10 to 15 yard light jog down and back, doing some skipping with high knees and maybe swinging your arms up. The active warm-up does get the whole body warmed up, but you can be more sport-specific to get the kids more interested in it. For example, baseball, just doing windmills with the arms and going through a throwing motion without a ball. Or soccer, just doing passing drills with the ball back and forth or dribbling. Anything that you can incorporate. If there's a ball in the game, maybe just tossing that ball around and getting everybody touching the ball and moving quickly and getting those muscles warmed up. After an active warm-up, static stretching would be okay, especially in the shoulder with the throwing athletes. And you want to make sure it's gentle. None of the stretching should ever be painful. Again, like I said, it should be light stretching and just holding stretches for maybe 5 to 10 seconds and maybe doing them 3 to 5 times would be fine. Core strength plays a huge role in injury prevention. Everything that you do activity-wise starts from the core. If you have a weak core, the whole rest of your body is going to be weak and you're going to be more susceptible to injury, whether it be an ankle injury, a knee injury. Coaches can easily put it into their practice plan, and you can get away with 3 basic exercises: planks, bridges, and clams. A plank is basically holding a position basically from your toes to your elbows. If you get down on your elbows and your toes and you want to hold that position, your back should be completely straight. Your spine and your neck and everything should be in alignment. You're using your abdominal muscles and your obliques to stabilize and to hold that position. Bridges is when you're laying on your back, your knees are bent, your feet are flat on the floor, and you're lifting your butt up off of the ground, holding it for a few seconds and coming down. And you can do different variations of bridging, both feet on the ground, one foot on the ground with the other one raised up. You could put your feet up on a ball. That'll also work the strengthening of your core as well as balance and stability in that position. Clams is a good glute muscle builder. It's when you're laying on your side, your knees can be bent up, and then you're just opening up or separating your knees, keeping your hips rolled forward, and you can add a band around the knees for resistance, add a weight on the top knee for resistance. The coach should add in the core strengthening exercises into their practice. Again, it's a simple 3 exercises: planks, bridges, and clams. And there's many variations of each of them too. The coaches can add those in and do different ones every day so it doesn't become a boring routine for the kids.
I think knowing what the coaching staff should do during an injury when they don't have an athletic trainer on their sideline is very important. They need to have probably one coach that needs to go out for every injury, and they're kind of the point person, and in my opinion it should be one of the assistant coaches. When contacting a parent regarding a player injury, the first thing to do is to let them know the severity of the injury, and if it's not serious, let them know right away it's not serious. Sometimes even a player will have to go to the hospital with a non-serious injury. But you may be in away at a tournament out of town, and a player sprains an ankle really bad, which is a pretty basic injury. But sometimes you want to go get an x-ray of it, make sure there's not a fracture there. Protocols for 911 calls are anything that cannot be transported safely in a car or that's life-threatening. And I don't ever have a problem with somebody calling 911 because the ambulance doesn't have to transport them. I think it's better safe than sorry, and I would say every EMS personnel that I've came in contact with, even when we haven't transported them, has always said yes, good call. Better to get us out here and be safe than sorry. Shock is the inability of the body to be able to deliver oxygen and blood to specific areas. And lightheadedness is one of the first signs of shock. Cool, clammy skin are things you want to look out for. And being nauseated is a sign of shock. Immediate treatment options for shock with a youth coach would first of all be to stay calm. The coach has to stay calm at all times. Even in the worst situation, if the coach does not stay calm, no one else will. If the patient or the athlete becomes shocky, first thing you got to lay them down. Do not put anything in their mouth. You have to keep an open airway. If they start to throw up, you want to vomit, you want to lay them on their side to get it out, because a lot of times they're not going to be able to move that well and get up, and they could choke on that. But the important part is lay them down, stay calm, and call 911. Whether or not a player who's gone into shock can go back into competition or practice that day, there's never really a sound yes and no answer to that. But my answer will be you always err on the side of caution. These are children that we're dealing with. And I don't care what game it is, it's never worth putting a child at risk that's been into shock to put it without being cleared by a physician. There's a wide range of categories for heat illness. Anything from muscle spasms to heat stroke, which is a life-threatening situation. The best thing you can do to prevent it is proper hydration. Heat illnesses will display themselves first with rapid and shallow breathing, weak pulse, normally quite dizziness, nauseated stomach, and anything from there to unconsciousness. Those are the signs and symptoms you want to be careful of. Sideline treatment options for an athlete that's going into heat illness are, of course, cooling the body with ice, a cold tub. If they're able to walk off the field, you need to lay them down is important, and get them some fluids right away. As long as they're not nauseated and they're going to vomit, throw up, giving them fluids is fine. You don't want to shove it into them, but as they can drink, you want to keep them hydrated. 911 should be called if the athlete does not come out of it within a short amount of time, 3 to 4 minutes. If they start to go into, start to have seizure-like symptoms or convulsions or severe cramps. The beautiful thing about 911 is that they carry intravenous fluids with them. And that is a phenomenal way to rehydrate very quickly. Most allergies are contact type, a skin allergy, or an environmental allergy, allergy to oak trees, situations like that, which are normally well handled with over-the-counter medication. It's the serious allergies of a bee sting with some severe shortness of breath and respiratory issues that you need to be aware of. The easiest symptoms to look for along the serious lines are shortness of breath and tightening in the throat. Some treatment options for allergies, of course, are over-the-counter medications, antihistamines, decongestants, cortisone cream for skin rashes. For the more severe allergies, where they go into anaphylaxis, that's prescription medication. It's either injectable, it's normally injectable, and if the athlete has that condition, they will have an EpiPen with them. It's epinephrine that will assist them in getting the muscle spasm to calm down. If an athlete ever has severe shortness of breath or a throat tightening, you immediately call 911. Diabetes is either a high or low of blood sugar in the blood system. The problem with diabetes are the athletes that have it but they don't know they have it. That's where diabetes can be dangerous. When I deal with anybody that may be having a diabetic issue, is I smell their breath. And if it smells fruity, I immediately know that they're having a diabetic issue. Cold, clammy skin, lethargic. If you have a player who goes to the bathroom all of a sudden a lot, that's another sign that you have to be aware of. In an emergency condition, the best way to treat, if you think it's a diabetic condition, is to get them something with sugar in it. A soft drink, a sports drink, a candy bar, a nutrition bar. Prevention of a diabetic incident with an athlete that knows they have diabetes is very important. Many times you'll be at a tournament where there's 5 minutes between games, and the athlete will need to check their insulin levels. They'll, and maybe need to medicate themselves, or may need just to get a good meal in them, and that's very important. And it's worth taking the time to make sure a diabetic athlete has proper nutrition and is properly hydrated between games than to let them go into a diabetic incident. EMS should be called for a diabetic reaction whenever the athlete is not responding to either their medication or to the sugar substance that you've given them. If they're not getting any better after just a minute or two, that's the time to call 911. Once again, err on the side of safety. Fractures, of course, happen to bones. It's a break in the bone. There's many different kinds of fractures. They're classified many different ways. Fractures range from anything from a compound fracture, where it's very easy to identify, where the fractured bone is sticking out of the skin, anything down from a microfracture or to a stress fracture, which you may not even know that you have. It just feels a little painful and it goes away in a few days. A common sign for a fracture, first of all, is pain. There's localized pain in the area. A lot of times it comes along with an injury to that site, like say an ankle sprain. You can invert your ankle and have a fracture along with the ligament damage. One of the first things you want to do is immobilize it. Now, there's many different techniques you can have. An ACE bandage around the joint is a great place to start with immobilizing it. You can even take a magazine and wrap it around the injury site, then put the bandage around it. There's very many simple tools that you can buy in first aid facilities for managing that. But the fact is, a fracture will take between 4 to 8 weeks to heal. And normally it starts out with immobilization. For fractures and calling 911, whenever the athlete is not easily transported yourself, if they become shocky, it's very important to call an ambulance. If they can't stand up and bear weight on a fracture site, it's normally a good idea to call an ambulance. Return to play protocols for fracture sites really depends on the severity of fracture and the fracture site. If it's an area that's not affected by your sport, you may be able to splint that and continue to play. And with stabilization, you can sometimes play, but that needs to be discussed with your doctor and properly splinted and protected.
So a nosebleed will typically display athlete running off the field. Usually head will be back, hands up on the face. You may or may not see blood, usually redness around the nasal cavity. So once you recognize a nosebleed, I think it's always good to approach it and stop the bleeding first. From there, make sure that you have your gloves on, giving the athlete some gauze to actually have him or her apply the pressure themselves. So applying pressure just above the nasal cavity, just kind of where the cartilage meets the bone, is always a good place to start. Athletes will have a tendency to want to tilt their head back. Don't do that. That can actually induce vomiting by having the blood kind of trickle down the throat. You know, I think if there's a fracture, it may be more difficult to manage. The bleeding will be a little more profuse. Sometimes the pain can cause the athlete to be a little more traumatic in their behaviors. An athlete can typically return to play from a nosebleed once the bleeding has been controlled. Always, when you're dealing with a nosebleed, make sure you're checking over the uniform. We want to eliminate any blood that may be on the uniform as well. So as a coach, what you want to look for with these types of injuries, redness, bleeding, deep open wounds are usually going to present themselves pretty quickly. You may get blood on the uniform. Officials may pinpoint that on the field and send them to the sideline for care. So stopping the bleeding with compression is going to be your first response that you want to do in managing these injuries. Sometimes I'll actually hand the gauze to the athlete and they can apply pressure first, and that allows me some time to get my gloves on and deal with the situation. These types of things can become emergent, more so with deep lacerations. You may see this more with hockey, where the skate can actually cut the skin and presents with a pretty large gaping wound. If bleeding can't be maintained, it's always a good idea to get others involved and activate the emergency system so others can control that injury. Athletes can return to play once the bleeding has been stopped and the bleeding is under control, the area has been cleaned, covered, and well dressed, and no more visual signs of that injury are present to other players.
Contusions or bruises occur when kids hit each other or the playing surface or a piece of equipment, whether it be a ball or sideline pole or goal or things like that.
Usually you'll have the athletes maybe holding the area of injury or contact. Sometimes they can present with immediate swelling. It's important that we make sure there are no fractures around the area. That's probably the first thing that you want to do. Always use the acronym RICE, rest, ice, compression, elevation, and always making sure that there's no bony deformity or abnormality around that injury. So in deciding a return to play situation with contusions, I think we want to make sure that the athlete can bear weight appropriately. Can they run? Can they jog? Can they go through that whole warm-up routine of high knees, butt kicks, carioca? Always assess that range of motion first. With a sprain, you're dealing with stretching, elongation, or sometimes even tearing of a ligament. And Conversely, the same would be said for a strain. Stretching, quick contraction, or overuse of a muscle/tendon. So by definition, anywhere you have a ligament in the body, so connecting bone to bone, you can sustain a sprain type of injury to that area. Muscle strains can occur anywhere in the body you have a muscle. Overextending, overreaching, I would say that's more common in a running sport. You see that football player running down the field and suddenly reaching behind his leg to grab his hamstring. Participating in sport without the correct warm-ups, I think, is one of the major contributors for those types of injuries. The athlete can present with immediate swelling, some discoloration or warmth, redness around the area. You may not see that purplish discoloration right away, but definitely you want to watch for warmth over the area of injury, redness, quick onset of swelling. They may present and walk off the field with a limp, so keep an eye out for that as well. Managing that injury, always use the acronym RICE, rest, ice, compression, elevation. And always making sure that there's no bony deformity or abnormality around that injury. So make sure everything looks like it's in place before you manage that injury. If you're trying to decide whether or not that athlete can return to play after a sprain or strain type of injury, I think you need to identify some key things. We need to look at range of motion. Are they able to achieve full range of motion, and compare that with the opposite body parts. Are they if it's the right ankle that's injured, can they achieve full range of motion similar or comparable to the left side? If they can do that, then progress them in a stepwise fashion. Can they go from full range of motion to weight bearing and tolerate weight bearing? If so, then progress them to walking, jogging, running, and then more specifically sports specific types of activities.
One of the most common treatments that we use for injuries is ice. For nearly any kind of injury or any kind of area that's sore, we apply ice, and physiologically the reason we do that is because ice will shrink the blood capillaries. It helps decrease blood flow and therefore decrease swelling. It also has an analgesic effect and will help the area feel better. So as you're making the ice in the bag, first you want to get all the air out of the bag. Spin it. And then tie a knot through the top. I'm going to put the ice on the sore area, which in this case is a sprained ankle out here. You should have an ACE wrap in your kit, and we'll wrap that around. We'll keep this on for 15 to 20 minutes until that area gets numb. Once again, when you're using ice cubes on the skin, it is not going to hurt the skin because the ice will melt so it doesn't get too cold. If you're using a commercial ice pack, that's when you want to have some sort of fabric between the ice pack and the skin. So when a laceration or scrape happens, first clean the area, make it free of debris, use some gauze to dry that area, and then you should have some sort of wound ointment, whether it be Neosporin or bacitracin or something like that. Apply that with a Band-Aid or gauze and then wrap it in place, because certainly on a sweaty limb or any area, a Band-Aid isn't going to stick by itself. When you're dressing a wound, make sure that you're applying enough adhesive or tape to keep the bandage in place. So you want to, it almost looks like you're putting too much tape on to keep it in place, but if it's on a knee or an elbow, you may need more tape than you would think. With any injury that involves any kind of swelling or warmth to the area, you want to apply compression. When applying a wrap, you want it to be snug but not too tight. So we'll start the furthest away as possible and work our way towards the body. You're going to angle upward followed by downward. Do include the heel and continue angling upward and downward. That creates a mechanism again to push the swelling away from the injured area and towards the heart. We'll attach the clips So you should see that there's a V sort of pattern as you're angling up and down. You don't want to apply it too tight or in straight lines because that will create too much compression and potential swelling away from the wrap. So on the sidelines, the easiest way to elevate an injury is, say for example, it is an ankle sprain, is to bring the athlete to the bench, put their leg on the bench level with them, and apply ice and compression on the bench. Our athlete has been playing, he's still on the field, and on the field you can use whatever you have to gain some elevation. So we'll have him lift his leg. The idea with elevation is that you are raising the injured area higher than the heart, and just relax. That way the blood flow can get back to the heart and continue circulation. We don't want swelling staying in the injured area because that's what prolongs healing. If you're concerned that the athlete may go into shock, we're still going to elevate the injured area. And keep the body warm. If the body decides to go into shock, it means that your vital organs, your heart, your internal organs aren't getting enough blood supply. So with elevation, you are allowing that to happen more effectively, as well as keeping the body warm. If it's something where you're concerned that they may go into shock, that's also a good time to call 911 for extra help.
Thank you for watching the Trusted Coaches First Aid video. The next step in completing your verification process will be to pass the online quiz. Additional resources are available for you to download from the trustedcoaches.org website and include a sample medical history form and a sample injury report form. Thank you and good luck with your quiz.